Okay, those of you who have seen Dave and I do speaking presentations know that a lot of times when we speak, we like to start off right off the bat with a way that you can absolutely save money or make money, just kind of a quick tip, a quick and easy tip that anyone can do that doesn't cost anything and will lower your overhead, make you money, save you money, whatever it is. So tonight I'm going to talk about something called Fat Merchant. A Fat Merchant is a company that we use at the Maddow Center to process all of our credit cards. And when people attend our seminars, use coaching, buy our products, whatever, just about everybody pays with credit card. And we were doing it just like most dental practices were doing it. We're using a credit card processor, maybe from the bank or independent company. And every time we put a charge through, the credit card processing company would skim a tiny percentage. They would call it an overage percentage off of our revenue. So the more people charged, the better that the company did, or the better that your practice is doing, the more you're paying to your credit card processor. And that made no sense, but it's just the way it was until recently. A disruptor in the credit card industry came along. They're called Fat Merchant, and they do not charge an overage percentage on every charge. They just charge a very low, flat monthly fee. So you'll know exactly what you're paying every month, and you will save money because it always turns out to be less than what you were paying your credit card processing company. So it's an incredible way to save money every month. We started using it at the Maddow Center, and we loved it so much that we recommended it to dental practices all across the country. And now so many dental practices across the country are using Fat Merchant. They just got ranked best credit card processor in US News and World Report. The magazine said that their transaction fees are lower. They have fantastic 24/7 customer support, and it's a cost-saving solution. So please check it out, Fat Merchant. And these days, of course, everybody wants touch-free transactions. Well, Fat Merchant can hook you up with these little machines. You just kind of hold them out. The patient puts their credit card in, they pull it out, you never touch it. Or if they've got one of those really cool systems like Apple Pay, Samsung Pay, Google, whatever it's called, they just wave their magic watch or credit card or device in front of the machine, and the charge is all done. So it's totally touch-free transactions. They can do things, take payments, email and text. The onboarding is a breeze. All you do is check out Fat Merchant, and they hook you up, and it's seamless, and you're good to go. So please check that out. It's maddow.com/save, special website we set up just for you, madow.com/save, or there's a phone number, and that phone number is just for dental practices. So if you call there, you won't get somebody that isn't familiar with your exact charging needs in a dental practice. So check out Fat Merchant. You'll save every month. Great tech also, really a modern high-tech company. Their interface is excellent. What else can I say? Fat Merchant, maddow.com/save. Okay, let's talk about 10 ways to create an incredibly memorable, I'm having trouble saying the title of this webinar, 10 ways to create an incredibly memorable patient experience in your office. And the first one comes from a really great book called Influence by Dr. Robert Cialdini. He is, I think, based in Arizona, and he is the world's #1 expert on influence. In other words, what are the things that we do to influence others? Now, when we talk about influencing others, of course, we always want to keep it honest. We want to keep it ethical. We don't want to do anything bad or tricky or con game or anything like that. Absolutely not. But we do want to take actions that influence our patients, because we want our patients to do certain things. Let's face it. We want our patients to show up for their appointments. We want them to refer their friends and family. We want them to say yes to the treatment we recommend. We want them to remain loyal patients in our practice and come in every 3 months, every 4 months, every 6 months, whatever it is. These are all the things we want them to do. But guess what? It starts with us, because as Dr. Cialdini showed in all the studies, the #1 most important thing in influence, now you see on that chart, there's some other things, scarcity, authority, but the #1 thing in influence to get people to do what you want them to do involves reciprocity. In other words, if you want a patient to do the good things that you want them to do, show up on time, refer others, pay, accept treatment, all those things, it doesn't just happen in a vacuum. It starts with us doing things to them to make them feel like they're the most important person in the world. I mean, let's just say that you're doing a hygiene check and you've only got a minute, you're in a rush, and we all know what that's like as a dentist, but you can do it in a way where the patient feels that you have 1 foot out the door and you don't even recognize them, boom, 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 see you later, boom. Or in that 1 minute, you can sit down, take a deep breath, chat with them while you're doing the exam. It's so great to see you. Oh, everything looks good. How was that vacation you took I was going to say last month, but nobody took a vacation last month. How's that vacation you took last year? Whatever it is, a little chit chat. In that same minute, you can entirely focus on them and make them feel like they're the most important person in the world. You know, how does a patient feel when they call your office and the first thing they hear is, dental office, hold please? Does that make them feel like the most important person in the world? Absolutely not. So the number one thing to do to create a memorable patient experience is realize that it starts with us treating every single patient like they are the most important person in the world. And everything else I'm going to talk about tonight, numbers 2 through 10, will all be fantastic techniques that you can use in your practice to make your patients feel good, to make them feel important, to make them love your practice, to use the power of reciprocity to have a fantastic dental practice and have patients that love your practice and refer and pay and show up and do all those fantastic things that we want our patients to do. So it all starts with the power of reciprocity. Okay, number 2 is something really cool. And this was shown to me by my friend, Dr. Robert Pick. Bob Pick is a periodontist in Chicago. And he's also a coach and a teacher and a blogger and he loves video blogs. Just a super enthusiastic guy with an incredible practice. And he does something in his practice that I just love. And with his permission, we're sharing it with you tonight. It's called the Pick Post-Procedural Video. So what is the Pick Post-Procedural Video? Well, a lot of us know about night calls, and night calls are fantastic. Night calls, you know, you see a patient, you did a crown prep or an injection of some sort, and you just call to check in at night, see how they're doing. Those are great. And I highly recommend night calls. But the Pick Post-Procedural Video takes it one step further. When Dr. Pick sees a patient that had perio surgery or maybe a really deep scaling and root planing, or most of us are general practitioners, so let's just say a crown prep, in my opinion, anything that warranted an injection is traumatic to the patient. Might not be traumatic to us, but it's traumatic to the patient. So instead of a night call, let's kick it up a notch and do the Pick Post-Procedural Video. And I've got a little picture of Bob doing it. There's a text. So Bob and his assistant, Kathy, his surgical assistant, had a patient and they did a procedure. And instead of taking 1 minute to do a night call, they took 1 minute and just recorded a tiny little video. Hello, Kathy, this is Dr. Pick and team. It was great to see you today. We're just checking to see how things went. You could expect a little soreness if you don't have any allergies. And I'm just making this up as I go along. Take a couple ibuprofen. If you have any questions, please just call me right back on the number that you're getting this text from. And if not, I'll see you next week for your checkup to make sure everything's fine. And you always get the patient's permission to text to them ahead of time. That should be in your intake form. Now imagine this patient is at home the night of a crown prep, a large restoration, scaling and root planing, a perio procedure, whatever it is, and they get a video texted to them by the doctor and team member asking them how they're doing and giving some pretty basic post-op instructions. That is an incredible wow. I guarantee you they've never seen anything like that before. So the Pick Post-Procedural Video costs no money. All it takes is your cell phone, 1 minute of your time. Nobody else is doing this kind of stuff. So please do that. And thanks to my good buddy, Dr. Bob Pick, for that tip. Okay. Probably my favorite tip of all time is never run late. Now, why do I have a picture of a pot roast on the slide that says never run late? That's a little weird. So here's the thing, and I'll make this really quick. There's an old story that this young couple gets married, newlywed wife cooks a pot roast for her husband, and the thing is delicious, and he's eating, he says, this pot roast is fantastic, but why are both ends sliced off the pot roast? He said, well, that's the way my mom taught me to do it in the recipe she gave me. Wow. It's just incredible. But I don't know why she does it. Let me call her. So she calls mom. Mom, why do you slice off the ends of the pot roast before you put it in the oven? Mom says, I don't know. That's the way your grandma told me to do it. That was her fantastic recipe. So that's the way I do it. Let's call her and find out why. So they call the grandma. The grandma says, I do it because that's the way my mom taught me to do it. And she always made the best pot roast. Now, mom, the great grandmother, Bubby, is 140 years old in the nursing home. and they all have to find out why Bubby cut off the ends of the pot roast. They all get in the car, they're driving to the nursing home, they're debating. I think it's because it lets the steam cook through the pot roast. No, it's because the spices soak through better. They're all debating why she cut the ends off the pot roast. They finally get to their great grandma's room. They say, Bubby, why in your famous pot roast recipe do you cut the ends off? Says, "Oy, Gewalt, in the old country, the oven was so small, the pot roast wouldn't fit unless I cut the ends off." The point is, they were doing something because that's the way it's always been done. What does this have to do with never running late? Well, here's an example. Why is it that we don't check our hygiene patients until the hygienist has finished the cleaning? Then what happens? The hygienist either pushes like a little button, or they have to go roaming around looking for the doctor. The doc's in the middle of an endo or a crown prep. They've got to finish what they're doing. They don't feel like taking a break then. So you have to wait 10 minutes for them, and then they come in, and then they're waiting 10 minutes for the hygienist. It's a stupid system, but that's the way we've always done it, and that's the only reason we keep doing it that way. What if, when the doctor had a little break in his or her schedule, you know what that means, waiting for a patient to get numb, your assistant's making a beautiful temporary, you're doing an impression, you finish a procedure early, whatever, when that happens, instead of goofing off, doctor goes into each hygiene room. It takes 2 minutes in each room. When the doctor has a break, and the hygienist knows it's not going to always be the end of the appointment, so she or he rinses the patient, sits them up, gives the spiel, hands the instruments, boom, 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 check, 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 little nice talk. A hygienist never has to wait for a doctor. A doctor never has to wait for a hygienist. You add hours of extra time that you never knew you had in your schedule just by doing that. But is that the answer to never running late? It's certainly a help. It's not the only thing you can do. So here's what I'm going to suggest you do. Call a team meeting and analyze your schedule from every single day that you run late. What did we do wrong? Did we schedule improperly? Did we not allow enough time? We're not going to listen to the doctor when she says, I can do a crown prep in 18 minutes, squeeze that patient in. Did you not have enough emergency time blocked off on the schedule, or new patient time? And that threw you off. What's the reason you're running late? You've got to figure that out first. And then say, this is our policy. In this practice, we do not run late. I'm telling you, patients will leave your office if you run late. They'll talk about it. Oh, I went to the dentist. I sat in that waiting room 35 minutes. People complain about it. They'll write it on your Yelp reviews. Always have to wait. I see it all the time. Patients hate waiting. They're not going to refer their friends, family, coworkers, and they may even leave your practice. So you've got to say, our office policy is, we do not run late. And then all your decisions are based on that. A patient is 20 minutes late for a 30-minute appointment. A procedure goes bad. You got to squeeze in an emergency. Whatever it is, every decision is made with that we do not run late attitude. And you can do it. You absolutely will not run late. And try the hygiene check thing too. It's fantastic. Okay, number 4. Dave and I and our coaches, of course, have been in thousands of practices across the country. And when we go to a practice, it's not just for fun. We sit there and we observe and we watch. And we like to think that everybody's on their best behavior when we're in the practice. But I cannot tell you, every single time I hear dentists and team members using dental lingo, dental terminology when they speak to the patients. And we don't realize we do it, because to us, words like crown, composite, periodontal, furcation, endodontic, whatever, these are normal words to us. We use this in our normal conversation, and that's great. That's how we communicate with one another as professionals. But the patients have no idea what you're talking about. And then what do? They get all stressed out. They feel stupid. And they go, We were in a practice, it wasn't that long ago. And again, when we're in that practice, everyone's on their best behavior. It's just unbelievable. And I saw the dentist in the room with the patient, presenting treatment, holding up showing the patient the digital x-ray on the monitor. Now, the patient has no idea how to read the x-ray, right? And saying something like, now, as you can see, there's a radiolucency on the apex of the distal root of the second. And what's the patient doing? And sure enough, that patient gave the old best line, let me talk it over with my wife. They weren't in any pain. The doctor never explained in lay terms, there's an infection in that tooth. And even though it doesn't hurt, it's an infection. If you don't treat it, this is what could happen. All they did was say, there's our, using dental terms, it was a horrible way to treatment plan. We do it all the time because it's a natural language to us. But unless that patient speaks dental lingo, and they don't do it. I always say, speak on the level of a sixth grader, because if a sixth grader can understand it, then a PhD can. But if you speak on the level of DDS, RDH, EFDA, whatever, only people in our profession will be able to understand what you're saying. So please, please, please do not use dental lingo. Now there's a corollary, there's a 4B, and that is, along with not using dental lingo, please, please, please do not get clinical on the telephone. What does that mean? A patient calls and they ask a question. We have an opportunity to invite them in to the practice, whether it's a new patient or a patient of record, so the doctor can look at their issue and determine exactly what it is. But if they start asking clinical questions on the phone, you're never going to get it right. Tell me, how much is a crown, whatever. Can you tell me what that means? Do I need a crown? You don't even know they need a crown. They might need endocoron crown. They might need an occlusal composite. You have no idea what they need. So don't start giving clinical advice on the phone, because since you're not examining the patient, you're never going to get it right. And if you don't get it right, but you're giving them information, they're going to hold you to that when they come in. Well, you told me this, and they feel like it's a bait and switch. And that's another kind of subtopic. Bait and switch is like the worst that you can do to a patient. They feel like they're being cheated, like they're being ripped off. It is a complete opposite of a memorable patient experience. That means if a new patient calls and they're asking about their insurance, and you give them one of those lines like, oh yeah, coming in for a free benefits check, whatever. We take all insurances, but you don't tell them that. Don't do a bait and switch on the phone. They're never going to be happy. Then from that moment on, when they find out that you weren't really, really telling the truth, you can do no right. And we want you to be the dentist that can do no wrong. So getting a little off topic here, don't get clinical on the phone. Now, we do secret shopper calls all the time. We've been doing them for years. We do them if we're working with a practice and they request them. We do them for our seminars. We do dental secret shopper calls. And I just have one on the PowerPoint here that I wanted to play you. It's kind of my favorite one of all time. And it's a really good example of what can happen when somebody gets clinical on the phone. Now, this was a simple question. Can you tell me what a root canal is? It would have been a lot better for that person to say, well, I'll tell you what, the best thing to do is have the doctor explain to you exactly what a root canal is. And let's do an examination too. You may think you need a root canal, but you might not even need one, or it might be a different procedure. So why don't you come on in? We'll do a free consult. We won't even charge. The doctor can have a little look-see and talk to you all about the root canal procedure. But don't do it on the phone. So here's an example. This was a secret shopper call. A patient called this practice and asked, what is a root canal? Let's hear what it sounded like. I hope you can hear that. Can somebody tell me in the chat box if you can hear this?
Good morning, dentist office.
Hi, I have a question for you. Do you do root canals there?
Yes, we do.
Okay, what is a root canal? Can you just explain that to me? I'm not sure what that is.
Well, they'll have you come in, and what they're going to do is take the nerve out of your tooth.
Wow. They just take the nerve right out of there?
Yeah, they're going to take it right out. Uh-huh.
And do they have to do anything
And then
else?
you'll probably need some more work after that.
Uh-huh. Like what kind of stuff?
Well, they're going to have to put probably a crown on your tooth.
Uh-huh. And does that take a long time to do that whole thing?
Pretty much.
It takes a long time? Wow, like how long?
Oh, I'd say about an hour or so. It depends. It depends on, how that tooth looks.
Uh-huh. Okay, and is it like kind of painful? I know some people say root canals are painful.
Well, for some people it is, and for some it isn't.
Wow. How do I know?
Well, when you're there, you'll know.
I'll know if it hurts.
Shouldn't be too bad.
Okay, I think I get the picture. Oh, hey, thanks so much for all the information. You've been very helpful.
You're welcome.
Okay, bye.
Bye.
Wow. Was that just unbelievable? She was so nice, right? You could tell that she had such kindness in her voice and her heart. She wanted to help that patient. She really wanted to. But she just said all the wrong things. It'll hurt. When you're there, you'll know. That's like the best advice for anything in life, right? When you're there, you'll know. And that patient hung up She didn't get any information from the patient, didn't ask them if they wanted to come in, scared the you-know-what out of them. Wow, that was a bad call. So I hope you'll learn from that example. Never get clinical on the phone. Invite the patient in for a consult. Speak to them without using dental lingo. Be kind. Show them all these other great things that we're learning about tonight, and create the memorable patient experience. Don't get clinical on the phone. Now, if you like secret shopper calls, and who doesn't love secret shopper calls, we do them every week on our Dental Practice Fixers podcast. So it's really a ton of fun. It's called the Dental Practice Fixers. Dave and I are the hosts of it. We do a lot of questions from listeners, but the main gist of it is we do mystery shopper calls to dental practices, asking all the questions that a potential new patient or even a patient of record would ask. We analyze the calls and we grade them. Don't worry, we bleep out the names of the offices, but it's really fun. You know, sometimes we get a lot of laughs out of it, but the main thing is we really learn a lot, because not only do we critique the calls, but we tell our listeners what that person could have done better. So I know a lot of people that listen to the podcast every week say it's the most incredible front desk training they've ever had, and their new patient numbers are up because the people that answer the phones at their practice are learning a lot, how to answer the phone properly and how to get the patients in. So check out the Dental Practice Fixers podcast. You can go to matto.com/dental podcast. You can get the latest one and all the back issues. We also do a video version of each one. So if you want to see what we look like, it's a little scary, but you can go to YouTube and just search for Dental Practice Fixers on YouTube. But as you see, it's on all the regular podcast channels: Apple Podcasts, Spotify, Stitcher, Google Play, YouTube, anywhere that you normally listen to podcasts or watch videos. You can check out the Dental Practice Fixers. So please do that. Don't forget, it's just once a week, about 20, 25 minutes each time, and you'll always get really good stuff. Okay, well, we're on number 5 already. Time is flying. I'm trying to keep this way under an hour because I know everybody's super busy. And I just do want to thank you for taking time out of your day. It's either the middle of the evening on the East Coast, or you just finished seeing your last patient on the West Coast, or Mountain or Central. You're somewhere in between those two. I know there are a lot of things you could be doing tonight. I do want to thank you for spending the time with me and with everybody at the Matto Center for this webinar. Okay, use the talk-over technique during exams. Well, a friend of mine, not that long ago, maybe about a year ago, moved to another town, and they switched dentists. And of course, you know, all my friends call me to report on their new dentist appointment, which is kind of crazy, but they do. So I'm talking to this friend of mine, and he said, yeah, it was really weird. He said, I went into the hygienist, and she did something that they didn't do in my old office. She was like feeling my neck and squeezing my neck and poking my cheeks and poking under my chin. Then she had me stick my tongue out. She's yanking my tongue and waving it all around. It was really weird. And then she checked and cleaned my teeth. And I said, well, did she tell you what she was doing? And he said, no, I had no idea what she was doing, but I didn't really like it that much. Boom. This went from something that should be an incredible. Now, this guy, that my friend, had never had this done in his previous office. So could you imagine if, when he was at that appointment, the hygienist said, okay, we're going to do an oral cancer screening right now. We're checking your glands, and these are glands that can frequently swell for all kinds of reasons, and I don't feel any swelling there. Your tongue's a place where we always check for oral cancer lesions, so I'm going to check this side of it, I'm going to check that side of it, looking at the roof of your mouth, the back of your throat. Well, it looks like your oral cancer screening was excellent. Good. What a difference that makes. From not knowing what somebody's doing and being annoyed to knowing that this new practice is giving a better level of care than the old practice. So always tell a patient what you're doing. And again, don't slip into the dental lingo. Do it in plain English. And this also will help your treatment plan acceptance, because when patients know what's going on during the exam, they're a little more in tune, and you're not kind of slamming them with this big surprise when you take them back into the office, or you do a chairside, you're doing the treatment plan presentation. Well, I'll give you an example. What does a patient typically hear during the perio exam? I'll tell you what a perio exam sounds like to a patient. 3, 2, 3, 3, 2, 3, 3, 2, 3, 3, 2, 3, 3, 2, 4. Good one. 3, 2, 3. Patient has no idea what's going on. What if before you or the hygienist does the perio exam, you just simply tell the patient in plain English, we're going to check your gums for inflammation and infection. Now, those are 2 words everybody understands. If you say, we're going to check your gums for periodontal disease and exudate, they have no idea what you're talking about. So don't forget the normal lingo. We're going to check your gums for inflammation and infection. We use this instrument. It's like a miniature ruler, and we measure how tightly your gums are attached to your teeth. Notice how I'm doing everything in 6th grade English here. We measure how tightly your gums are attached to your teeth. And if you hear a 2 or a 3, that's typically a sign that your gums are really healthy. If you start hearing a 4 or a 5 or a 6, that's a sign that there's inflammation or infection in your gums. And that's an area that we're going to be concerned about. What an amazing thing to say before your periodontal exam. Use the talk over technique. Now when they're hearing 3, 2, 3, 3, 4, 4, 4, 4, 5, wow, I've got some inflammation and infection in my gums. I guess the doctor or the hygienist is going to be talking to me about some kind of treatment for that. So it sets the stage for your treatment plan presentation, but it also tells the patient what you're doing so they're not in the dark. You can do it on your hard tissue exam too, instead of like a number 3 MOD amalgam. Well, I know you need to do that also, but what if you say tooth number 3, the upper right first molar has a large 3-surface metal and mercury filling, and it's breaking down, and I can feel that there's a gap between the tooth and filling. Oh, it feels like there's some decaying bacteria underneath the old filling. Boom! You're not only informing the patient because they're wondering what the heck is going on, you're also setting the stage for your successful treatment plan presentation. So use the talk over technique during all of your exams. Increases the memorable patient experience and helps you with your treatment plan acceptance. Okay, that's number 5. We're rocking. Let's move on. Oh, real quickly, before we get to number 6, I just want to let you know, a lot of people are asking us what it's like to work with us at Matter Center Coaching. And we love working with practices all across the country and helping them to grow, to enjoy dentistry more, and to earn more income, of course. We are not the largest dental consulting firm in the country, nor do we ever want to be, because we take the time to know each of our clients personally, and we don't do cookie cutter, one size fits all stuff. We do custom treatment plans, you could say, customized for every practice we work with. Our coaches are incredible, and I feel like I know every single person that we work with, at least on some level. So if you want to find out what that's all about, let's do a quick start. Some practices, we just do kind of a quick 6-week program to analyze what's going on and to figure out what's our first step, what's our second step, what are we going to do to get your practice back on track. And we might say, let's work together for a year, but we might say, let's just do the quick start. So check it out. It's a real easy way to get familiar with the way we work, to find out what it's like to work with the Matter Center as your coaches. If you want to do a quick start, the first step is a phone call with us. I might even be on the phone call. Certainly one of our coaches will be. I might be there too. So just go to matto.com/quickstart. There's a little, we might call it like an intake form. We'll just get your name, your cell phone number, your email address. We'll set up a phone appointment. It's easy. It's painless. We are so low pressure. As you can tell, we're not pushy salespeople. We just want to meet you, learn a little bit about your practice, and see if we think that we should work together. See if we think we can really help you. Find out what you think you need, what we think you need to get your practice to grow, to make you love dentistry more. So just go to matto.com/quickstart. And something else we're doing, we've never done this before. This is kind of something for the COVID or the post-COVID era. We used to gather maybe 5-6 times a year in Baltimore and do master classes where 8 to 10 dentists would come in from all across the country, and we'd sit around and kind of get down and dirty and learn about your practices and your successes and your struggles and talk it out and really learn a lot and figure out what we could do to help your practice. They were great days, but we can't do them anymore. So for the first time, we're trying something called the Dental Success Forum. It will be very similar to the in-person masterclass, but we're going to do it just like this. We'll do it on Zoom. We'll have about 8 dentists from anywhere in the country, all going to meet together. We'll confidentially talk about our practices, our strengths, our pain points, as they say, the areas where we think we use some help, some things that are frustrating you. You might be looking for some solutions to some issues. It'll all happen on the forum, but it's going to be a very small group. It's July 30th at 8 p.m. Again, you do it from the comfort of your home, your office, your car, the state park, wherever you're hanging, anywhere you've got a Wi-Fi or data and a laptop or a cell phone, you're in. You can be in the forum. So we do expect it to fill up because, again, we keep it really small. So if you want to sign up, you can even do it right now. I won't be offended if you put me on pause. You can go to matto.com/forum and you can sign up for that. And again, we're only taking a limited number of docs. This is for practice owners only. Same with a quick start. We love associates, we love hygienists, but these things are for people that own their own practices. So Matter.com/forum, Matter.com/quick start, take your pick. Either way, it's going to be a fantastic experience. So this should be something really, really cool. Okay, number 6, the old blue sheet. Now, I used to call it the blue sheet because, again, I started my practice. Well, I graduated school in '84, residency associateships, but started my own practice in '86. And in those days, everything was manual. So now the blue sheet's more of a metaphorical blue sheet. Obviously, you won't have a piece. You could do a piece of paper, but we do it electronically these days. But I call it the blue sheet because I used to do it on a blue piece of paper that I stuck on a Post-it note in front of each chart. So the blue sheet creates a memorable patient experience. It simply is, when you're chit-chatting with a patient, these little things always come up, personal things in conversation, something personal about the patient, a great experience they had, something about their family, something about their work, about a vacation they want to take, whatever it is. When they tell you something personal, you're not going to remember it 6 months later. You're seeing thousands of patients. Maybe sometimes you will, maybe 10 to 20% of the time you will, but chances are you won't remember it 6 months later. So jot it down on the blue sheet, or these days, of course, in the electronic patient record, a couple little personal notes about your patient. Here's my example. This patient, Sue, comes in and we're chit-chatting. And this was, months ago. And she says that she's so excited. She's expecting her first grandchild in October. And then you're chit-chatting about this, about that. And the song Let It Be comes on the office music system. And she's, oh, I love the Beatles. I just love the Beatles. Okay, boom. Make a mental note. These are important things. Don't forget it. Don't just, pass it off. Write it down. Write it on the blue sheet. So then what happens? 6 months pass. Now it's last week. Sue comes into the office and you're doing the exam, you're chit-chatting. Wow, so what's going on with the grandchild? Everybody must be so excited. Your first grandchild's going to be here soon. And she just lights up. She can't believe you remember that. And then you're chit-chatting. Can you believe Ringo Starr turned 80 last week? Did you see that TV special on him? Oh, I love the Beatles. How did you remember that? Patients love this. It's a nice thing to do. Patients love it. They're really impressed. They think you're the greatest doctor in the world when you remember little personal things about them. So use the blue sheet. Kind of an extension of the blue sheet is the new patient note. And this is anytime you see a new patient in your practice, somebody in the office is in charge of giving the doctor a little printout or email or however you'd like to do it at the end of the day with the patient's name and then one little tip from the blue sheet. So here's an example. My new patient that day was named Allison. She went by Allie. So we noted that. And on her blue sheet, she was very nervous about her presentation at work the next week. So when this is for every single new patient. You don't have time to write a custom note for each patient. You can't remember all that stuff. So the whole note is rote. It's generic, except for the patient's name, the day of the week, and the blue sheet comment. In this case, Allie gets home. She gets her note handwritten in the doctor's sloppy handwriting in her mailbox. Handwritten notes have gone by the wayside. People love them. It is the most incredible way to show that you care. So handwritten notes. She got this in her mailbox. Dear Allie, it was great meeting you at your new patient appointment. Blah, blah, blah. Thanks so much for showing your confidence. Now, so if you have any questions, please feel free to give me a call at any time. Sincerely, I'm pretty casual. I go by Rich Maddow, but you might want to write, Dr. Zambito or so-and-so DDS or whatever it is. P.S. Good luck with your presentation. Wow, I took the time to not only write her a note to thank her for coming in, but remembering something personal about her. People hang these up on their refrigerators and they stay there for years. It's unbelievable. And their friends come over and see these new patient notes. This is an incredibly memorable patient experience. So do the new patient note with your blue sheet comment. That's like a two for one. Okay, let's move on to number 8. Before we get to number 8, I just want to let you know too, when we finish the 10 ways to create an incredibly memorable patient experience, I'm just going to share with you real quickly 10 things you should never say to a dental patient. Where did these 10 things come from? These are things that Dave and I have heard personally in dental practices across the country when we visit. None of them were made up. And we have a list of hundreds of these, but I just picked 10 random ones for tonight. These are 10 things that we've actually heard dentists saying that you should never say to a dental patient. Okay, that's coming soon. A little teaser there for the end. And I see not too many people are writing in the chat box, but if you want to write a comment or question, feel free to. We'd love to hear from you. I see Sylvia, who is our webinar manager, is answering some questions for people, and maybe I'll answer some too. Oh, Betty Hayden comments on that phone call that it hurt her heart. Betty's one of our incredible coaches at the Maddow Center. So see, she takes it personally. She gets hurt when she hears a practice do something like that. Okay, number 8, calibrate your practice. What does that mean to calibrate your practice? Well, what do you think would happen if a patient went up to each team member in your practice individually and said, what is a crown? Or why do I need a crown? Or why does somebody need a root canal? Or do you take my insurance? How much is a cleaning? I guarantee you, if they ask that individually and like under the cone of silence to each team member in your practice, they'd get a different answer from every single person. And it's very confusing, and it doesn't show consistency, and it doesn't create an incredibly memorable patient experience. So your practice needs to be calibrated. Here's a quick way to calibrate your practice. Actually, when we do our seminars, usually if it's in the context of what we're talking about that day, Dave does a great segment on practice calibration. He probably spends 15 minutes on it. So I can't do it justice in a minute and a half. We're going to try anyway, just so you get the gist of it. Calibrating your practice means that when a question is asked, every team member gives the exact same answer. It should be that way. There should only be one answer to every question. So every team member, now it doesn't mean they spit it out like robots, like our crown is a restoration made of porcelain and gold. No, you do it in your own words, but it should be essentially the same answer. So how do you calibrate your practice? Well, here's a way to do it. Have everybody submit one question, or everybody submit 3 questions. It doesn't matter. Let's get a list on index cards of typical frequent questions that patients ask, and they can be simple questions. It could be, are you seeing new patients? It could be, what is a crown? Why would somebody need a crown? Why can't you just fill it? That's one of my favorite ones. Why can't you just fill it? Everybody should know a great answer to that. So make a list of all these frequently asked difficult patient questions, have them on index cards, then call a team meeting. Pull the first question out of a hat or a cap or a mask. I don't care what you pull it out of, a shield. Pull the first question out and read the question, and everybody will give their opinion, and we'll talk about it, and we'll discuss, and we'll say that's good, and maybe that doesn't work, and we'll tweak, and we'll tweak, and we'll tweak until we come up with what everybody agrees is a fantastic answer to that question. And then somebody who's the secretary of that meeting will write it down, and then we will type it up on an email, and we'll distribute it, and we'll make sure that everybody in the office has the answers to these questions. Now, does that mean that you go memorize it word for word so you sound like Mr. Robot? Absolutely not. But it means that you get yourself extremely familiar with it. So anytime a patient asks a question that's similar, you will have that answer. The front desk team will have the answer. The hygienist will have that answer. The dental assistants will have that answer. And can you believe it? The doctor will have that answer too. Your practice will be calibrated, and every patient will get the same answer to the question they ask. This creates an incredible, memorable experience. Okay, this could be the most important thing of all when you're creating an incredibly, I don't know why I can't say the title of this webinar, an incredibly memorable patient experience. It is all about your team. Let's face it, the doctor needs to do a lot of things right. The doctor needs to really care, do great dentistry, be pain-free, be caring, show compassion, but 90% of the interaction that a patient has in your practice is with the team. So when it comes to creating a really memorable experience, most of that is focused on the team. Most of that is provided by the team. And there's a picture of a really happy team, and that's on your right. That's one of our coaches, Betty Hayden. She just did this office visit. I think this was her first post-COVID office visit. A new team she's working with. Look how happy everybody looks, because they just had 2 incredible days of learning with Betty. So that's a great team, and it's all about the team. Now, this is a paraphrased quote by Simon Sinek. He's a fantastic customer service expert and speaker. I paraphrased it for dentistry, and that is, the quality of the care you give your patients will not exceed the quality of the people who provide it. It's kind of like how they say, if you've got, in the old days, you had a big stereo, you had the turntable had a cartridge, the cartridge had a needle, then you had an amplifier and a tuner and speakers and the record. There were so many parts, and the sound that finally came out of the speakers were only as good as the worst components. So if you had speakers that were so good they were bad, or speakers that were so incredible, and the best turntable and cartridge, and the record was brand new and had great sound, but your power amp or your receiver was not good, you'd have bad sound, because the sound was only as good as the weakest component. And it's the same thing in your office. The quality of the care you provide is really only as good as your weakest team member, only as good as the quality of the people who provide it. So your team needs to be top notch in providing incredible care to make every patient feel like they are the most important person in the world. Here are some things that you can do, that your team can do. First of all, doc, if your team doesn't know the practice goals and doesn't know your expectations of them, how can they ever provide? How can they ever meet your expectations? How can they ever hit your goals if they don't know them? So communicate your goals and expectations. And to take it to the next level, ask for your team's input. I know some people are those bosses where my way or the highway, I said it and that's good enough. That doesn't work these days. And you will be amazed if you've never done this. Your team is on the front lines. You're seeing a totally different view of the practice than they are. They know every inch of what's going on in there. So get their input. They will come up with amazing suggestions for better patient care. So always ask your team for input. Be friendly, be grateful, be respectful. How do you expect your team to be friendly and respectful and grateful to your patients and to you if you're not showing that behavior? Compliment your team. Better yet, compliment your team in front of your patients. I know this sounds like kindergarten, but say please, say thank you. Don't bark out commands. Be kind and be nice. It's always worth the extra split second it takes to be kind and be nice. So doc, it starts with you. Be respectful, be kind, and reward positive behavior from your team. Sure, it's great to have bonuses. It's great to have pizza lunches brought in, but the best thing is a compliment or a comment when you catch them doing something really well. So great way to get your team on board. Gossip, negativity, backstabbing, nothing good comes out of that. Nothing. I mean, gossiping about other team members, gossiping about the doc, about people's private lives, about your patients, saying negative things about your patients. Look, let's face it. We're seeing people at their worst many times. We can say negative things about our patients all day long. Where does that get you? Don't do it. Positivity rules the day. Gossip and negativity are not allowed in this office. That is a rule, and not allowed outside of the office either about office things. Just don't do it. It's a hard habit to break, but once you do it, you'll see, shoo, it's like a whole different atmosphere. Along those lines, patients will not love your practice unless the team loves your practice. I just saw a quote, I think I saw it today, and I wish I could remember it. It was something like, stress comes from doing a job you don't like. Love and gratitude comes from doing a job that you love. So everybody needs to love the practice. The team, if the team is stressed out and not enjoying what they do every single day, that reflects back to the patient. So all these things we talked about, great ways to get your team to love the practice. And please invest in your team. And I'm not talking about high-tech gadgets, nothing against them. That's usually the worst investment you can make. So training, continuing education, protocols, coaching, even have a team meeting and bring in a nice lunch to show them that you care, whatever it is. Don't be a cheapskate. I'm not saying to blow all your overhead so that your office is operating at a loss. Of course, you don't want to do that, but invest in your team. Training, CE, protocols, coaching is incredible investment for the team. Do nice things for your team, unexpected nice things. It goes a long way. So that's number 9. Once again, real quickly, before we get to number 10, and then the 10 things you should never say to a dental patient, we're doing this really cool thing for the first time called the Forum. It's kind of like an online masterclass. We used to do these in Baltimore or in several places across the country where 8 to 10 dentists from across the country would come in and congregate for a full day, and we'd chat and we'd discuss, well, we can't do it live anymore. This should be even better because you don't have to get on a plane or in a 4-hour car ride. Whatever, you can do it right from the comfort of your own home. It's called the Forum. We're going to have a very small group, dental practice owners only on the Forum. It's going to be 8 p.m. on July 30th, 8 p.m. Eastern time on July 30th. I'll be there. Some members of our coaching team will be there, and some really cool dentists from across the country will be there. And we'll talk and we'll chat. We'll talk about what's going right in our practices. We'll talk about what our struggles are. We'll talk about where we think we need improvement and how we can get there. And it will all be confidential. We're not going to record it and put it up on Facebook or YouTube. I promise. Everything that's said in the forum will remain in the forum, kind of like Caesar's forum in Las Vegas. Anything that's said there stays in Vegas. Anything that's said in the dental forum stays in the dental forum. So that's for practice owners only. And please, well, I want to go back to that slide. There it is. It is matto.com/forum, matto.com/forum. I see somebody put up a number for Fat Merchant. That's going to be just in a couple slides, so hang in there. I don't have it right at my fingertips. I can tell you, though, the website for Fat Merchant is matto.com/save. Maybe Sylvia, you can type that. A lot of matto.com slashes. They're the easiest things to remember. So the forum, matto.com/forum. I see that Betty Hayden's going to be there, and she'd love to have you there, too. I think Coach Kara's going to be there, another one of our fantastic coaches. She is in Seattle, the Citadel. So, please join us at the forum, matto.com/forum, or if you want to schedule a little phone call and find out how to quick start your practice, just go to matto.com/quickstart. And of course, you can get any information by dropping us an email, info@matto.com, or call our number there, 800-258-0060. So there you go. 2 great ways that we can work together and help your practice. Okay. Number 10, are your new patients friends or strangers? A really, really close friend of mine just moved a few months ago to a city in Florida. And like my best buddy for life, we've been friends since we were in 3rd grade. So we've been friends for 56, 57 years. I don't know, 56, a heck of a long time. He moved to Florida like a lot of East Coasters do when they get older and retire. And he asked me to recommend a dentist. So I knew an incredible dental practice in his town. I didn't know that much about them. I think I maybe communicated with them once or twice, but I knew they were incredible dentists. And he called me after his first visit there and said it was the most amazing dental experience he ever had. So of course, I get out my computer, I'm tapping away, making notes as he's telling me what they did. And he said, one of the things that they did that really impressed him was by the time he got there for his first appointment, he felt like they already knew him. He felt like he was a friend of the practice. He didn't feel like a stranger. And think about it, being a new patient is so stressful. I know that when I'm a new patient of a physician, I feel like an outsider. I feel like I'm not one of the gang. I feel like a stranger. Nobody knows me. And I go in and they, stick that sign-in sheet in front of me. I got to fill out a million forms. It's just an uncomfortable feeling. And he said that when he went there, he felt like a friend because he said, first of all, when he called to make his initial appointment, the person had all day to talk to him. And they asked him some questions and they knew that he just moved. Well, why did you move to town? And, where do you live? What part of town are you in? And, what do you do? And they're asking him all these questions, getting to know him. It was really nice. And then all of the kind of pre-op intake was done on the computer. They let him do that. And then after he filled out his intake form, somebody from the practice called to review it and just get to know him better, ask him all kinds of dental questions, but they also asked him personal type questions. So they got to know him and they got to know what his likes were and, all kinds of personal things. And then the night before his appointment, the doctor called just to say hello. He said the call took 30 seconds. But it was the most amazing call because he's never had a doctor call him the night before the appointment. And by the time he got to his initial exam, he wasn't a new patient. He was a friend, and they greeted him like a friend, and they treated him like a friend. So are your new patients friends or strangers? Please do everything you can to make sure that your new patients and all of your patients are friends of the practice. So we're just about going to wrap it up. It's almost 9 o'clock here on the East Coast. 8 o'clock for our central friends, 7 Mountain, 6 o'clock in the Pacific, and Alaska and Hawaii. I have no idea what time it is there, but thank you so much for joining us. So 10 things that you should never say to a dental patient. Real quickly, Fat Merchant is the most incredible way to save money in your practice every single month. It's the best credit card processor. We use them at the Matto Center, and you should use them too because they do not charge an overage percentage on every charge. That adds up. It's almost like the better you do, the more you're paying for your credit card processing. Well, that's ridiculous. Fat Merchant only charges one steady monthly rate. It's a fixed rate. It's the same every month. It's very low. Go to matto.com/save or call this phone number 844-860-9951 and find out what it's like to work with Fat Merchant. We use them at the Matto Center. We've recommended them to so many dental practices across the country, and you should use them too. And actually, that'll help you create a memorable patient experience. They'll do contact-free charging. Everything's high-tech and seamless. Do it. There's no reason not to. It's like, as we say, it's the no-brainer's no-brainer. Use Fat Merchant. Never look back. It's the kind of thing where all you do is make one call, one setup, and then you're set. It's not like trying to talk your supply guy down every month or, other things. One call, one setup, and you're done for the rest of the time you're in practice. You'll save money every month. Geez, could be the best phone call you ever make. Okay, 10 things you should never say to a dental patient. And I'm telling you, we heard all of these things said in dental practice across the country. This won't hurt a bit. Well, how do you know it won't hurt a bit? What if it does hurt? Never make a promise that you can't fulfill. Better to make sure your patient is incredibly comfortable before you start the procedure, and then stop every few minutes, give them a little pat on the shoulder and say, is everything going okay? Is there anything we can do to make you more comfortable? Don't make a promise that you can't keep. That's a losing proposition. I'm sorry, but you're wrong. Never tell a patient that they're wrong. I don't care what the patient says. I don't care if they tell you that their uncle has a tooth growing out of their back and their grandfather had 3 sets of teeth. No, not dentures. No, he lost his baby teeth. Then his regular teeth came in. Then they had to be taken out. Then a 3rd set of teeth came in. I mean, you hear stuff like that. I'm sorry, but that is scientifically inaccurate. Who cares? Just, oh, that's one for the books, whatever it is. Just laugh along with them and get going. I don't care what it is. I don't care if it's about their payment, their insurance, even if they are wrong. Don't say, I'm sorry, but you're wrong. Just say, well, let me show you what our calculations showed, and let's check with the insurance company. Be kind. People don't like to be wrong. You don't have to prove that you're right. You do have to do the correct thing, but you don't have to tell somebody that they're wrong in no uncertain terms. Oh, that's nothing. Now remember, the things that we do in the dental practice are nothing to us. We do them every day. Perio scaling, not one crown prep, a tiny little crown prep that you're going to be known for, that's nothing. A DO composite, oh my, it's nothing. But to the patient, it's not nothing. So don't belittle them. Don't tell them that they're wrong. Don't make them feel like they're ridiculous thinking that it's something. It is something. It's something to them. So don't say, oh, that's nothing. Say, well, let me explain to you exactly what it is, and let's talk about how we're going to make you extremely comfortable for this procedure. Don't just slough them off and say that's nothing. We can't do that. The answer is no. We can't do that. Now, look, there are some things you can't do. If a patient calls and says they want to come in Thursday evenings and you don't have Thursday hours, you're not going to open up the practice just for them. But don't say, no, we can't do that. Just say, oh, it sounds like maybe you're looking for some evening hours. Well, did you know that we're open Tuesday evenings? And guess what? We just open 2 Saturdays per month. Would that work for you? So much better than, we can't do that, whatever it is. Well, that's the way we've always done it. We talked about that way back in step number 2. Never do something because that's the way we've always done it. There's always better ways to do things. It's always great to think, come up with ideas. I think it's great to encourage ideas from your team, even from your patients. Never do anything only because that's the way that you've always done it. Number 6, this is malpractice. Sometimes you look in somebody's mouth and you see what their past dentist did or what you think they did, and you just want to scream. We were in an office one time and a new patient was being examined, and the doctor looks in, shakes his head and says to the patient, this is malpractice. First of all, why would you ever put that word in a patient's mind? You're going to be the one they sue eventually. Never use that word. But it's never good to badmouth a colleague. I don't care if that dentist was the worst dentist in the world. That patient probably loved their old dentist. And you weren't there when they did the work. You have no idea what the circumstances were. So never badmouth another dentist's work. If a patient starts saying, well, my last dentist never did this, my last dentist never told me that, just say, well, I wasn't there when your last dentist did the examination. I don't know what they saw. And, maybe things were different when they did the examination, but all I can tell you is what I'm seeing right here today. And let's talk about that and move forward. But don't blame the old dentist. It's never a good move. Hey, did you watch the debate last night? That's just an example. Politics and religion, topics we might think about a lot. Today there's civil unrest in the country, all kinds of things that are going on. That's not the kind of stuff that you should be talking about with your patients in the dental practice. You might think you know how your patient feels about a certain thing, but it doesn't matter. Just don't go there. There are so many great positive things to talk about. And if somebody starts bringing it up, change the subject. If you have to, say, hey, let's talk about something else. We don't like to discuss politics in our dental practice. Just do it. Don't take the bait. Don't let somebody get you all angry and frustrated or in a debate or, everybody's blood pressure is going up. Politics, religion, controversial topics do not belong in your dental practice. So where's Linda? I see she's not at the front desk. Oh, Linda was fired. Why did you ever say that? Obviously, this person's here looking for Linda. There's so many better things. Linda's not with the practice anymore. Whatever. Linda moved. Linda's now working in a chiropractic office. Whatever it is. Linda was fired. No, we heard somebody say it. This is something we talked about earlier, but I just have to reiterate. As you can see on the radiograph, there's a radiolucency. Don't use dental terminology. Everything should be done in plain English. And then we actually heard this in a dental practice. A dentist is working on a patient's mouth and says, oh, shoot. But they said the R-rated version of that right in front of the patient. If you have to, if you're about to say something like that, just stop. Just count to 5. Just do whatever it takes. Don't say whoops. Don't say, oh, SH. Just don't do it. And it's not funny because we have heard this in dental practices. So 10 things you should never say to a dental patient we've actually heard. Well, we're coming to the end of 10 ways to create an incredibly memorable patient experience in your practice. I'm so glad that Stacy loves number 8, calibrate. It's a really, really great tip. So once again, I'll just remind you, join us at the forum. It's going to be an online dental forum for practice owners only, maybe 8 to 10 dentists, totally private. I'll be there. Some members of our coaching team will be there. We'll talk about your practice. We'll learn about what's going well, maybe some of your struggles. We'll talk about some solutions. It'll be a great way, very small group, just with the Matter Center. It won't be recorded. It'll be completely private and confidential, kind of like our in-person masterclasses that we're not doing anymore because travel's kind of on hold. So this could be even better because you won't have to get on a plane. You can do it from the comfort of your home or office. So go to matto.com/forum. Don't wait. I have a feeling it's going to be, well, I'm going to say sold out. There's no charge for it. I have a feeling it's going to be full. And we're doing quick starts. Yes, ready to quick start your practice? Please, matto.com/quick start. That's info@matto.com if you just want to learn about anything. Again, the forum and quick start are definitely for people that also want to learn more about what it's like to work with us as their coaching team. They're not high pressure. We're not going to twist anybody's arms, but it's definitely for people to find out what it's like to work with us as their coaches. And that's why it's for practice owners only. So 2 ways to get to know us a little better, for us to get to know you a little better. It'll be fantastic. So take advantage of those. Somebody's saying, are there any programs for new practices? All of our things are for practice owners. So if you're the practice owner, sure, we'd love to talk to you. I think that might be it. 10 ways to create an incredibly memorable patient experience. Again, if you want to get in touch with us, there's some contact info, matto.com, info@matto.com. If you want to email me directly, it's Rich, R-I-C-H, @matto.com. There's our toll-free phone number. And I'm going to say it's time to say good night. You are so welcome. I see a bunch of people saying thank yous. It is my pleasure. We love doing these webinars. Again, I'm Dr. Richard Matto, co-founder, along with my brother, Dr. David Matto of the Matto Center for Dental Practice Success. And I cannot wait to meet you at the forum or on a quick start, or maybe even on our next webinar. So thanks so much, everybody, for being with us. It was a blast. Thanks for taking time out of your busy schedule, and I'll talk to you soon.